But they started it was called a fast track program. It was LPN to RN. It was a 1-year program, and it was through Excelsior College. And so I decided, all right, it's time to move on and to expand. So I was accepted into that program, and a year later, I received my RN associate's degree. That same nursing director, probably 3 weeks after I graduated, said, all right, it's time for you to be a leader. We've recognized that in you. So I have a night shift clinical manager opening in one of my critical care step down units. And I said, okay. At that point, I didn't see it in me to be a leader, but staff that I had worked with and friends that I'd worked with said, you're just a little bit too bossy, maybe to be a staff member. You might want to be a leader. Okay. So I took the clinical manager position. And what that was, it's 85% clinical, meaning you're on the floor, you're taking care of patients, you're taking care of your staff. 15% of it is administrative duties, like doing evals and unfortunately have those crucial conversations with folks. So I did that, really was starting to get into the hang of that. About 9 months later, same director said, guess what? The nurse manager just quit. You're going to do that. I couldn't have been more fearful. It was like, oh my, I was okay being one of 3 clinical managers, but now I'm going to be the person that everyone needs answers from. But I believed in my nursing director. I was gaining more confidence in my RN leadership, and okay, I'll do this. So it was quite a journey. That was 2 years. I took the nurse manager position. That unit was going through some trying times, lots of turnover, lots of dissatisfaction because of nurse to patient ratios. We were getting pretty sick patients coming to the unit, being discharged out of our critical care sooner than probably expected. So I do feel that we did turn that unit around. We lowered the ratios. We became a pretty happy team there. Same director came and said, listen, I know you're happy, you're right where you want to be, and critical care needs a nurse manager, and you're going to do it. Okay. I believed in her. I believed in me. So I moved to critical care. And of course, that was my home for 15 years. But I was a staff nurse when I was there, and it was my home. I went back as their nurse manager, and they hadn't had a nurse manager for about 6 months. And it was different. I cried for probably 3 weeks thinking, why did I leave my home? These folks are not the same folks I left. But the turning point with that, I think staff understanding where I came from, it was one of those, I think it was Hurricane Sandy, or it was one of those storms. And the folks that needed to be near the hospital went to local motels. I slept in my office. I got out a foam pad and got some blankets and slept in my office. Staff saw engagement. That was the turning point. That was the best career move I had ever made. So I was their nurse manager for many years. Same director came to me and said, Waynesboro, our sister hospital, is having trouble in critical care. Would you go and be their director and stay the nurse manager here and do a dual role? You can you know where this story's going. Okay. Let's spread the wings a little bit more. I spent 3 years at Waynesboro being their director of critical care and the nurse manager at Chambersburg. It was tough. When I was at Waynesboro, I wasn't totally engaged at Waynesboro. I was thinking what was going on at Chambersburg. And of course, when I was at Chambersburg, there was fires burning at Waynesboro. But, it was a great leadership experience. It was a different culture at Waynesboro. It's a littler town, but it was absolutely amazing. And the leadership lessons I learned were I'll take with me forever. So came back to Chambersburg. They decided to make a dual role for me. So I was nurse manager and director. And now I was a comrade to the director that had actually paved the way for me in leadership. We split up some of her areas. I was the nurse manager director then of the critical care unit and of the respiratory care unit. I learned all about RTs very fast and furious. And then I knew that my director was going to be retiring soon. And I was doing all this with just an associate's degree. So I knew I needed to go back and get my bachelor's, but I figured, Wilson College was offering an RN to MSN program. And I figured, okay, let's try that. Let's go to school at the age of 57. Let's go get your master's and see what that's like. I figured it would ward off dementia and Alzheimer's. So I figured let's keep the mind sharp. So went back, got my master's, my director retired, and then I picked up all the different areas. So I am currently the director for critical care, IMCU, critical care step down, teleops, and the overflow areas, respiratory, the cath lab, EP studies, research, device clinic, and outpatient cardiac testing. Okay, it's good. It's great. I am never bored. I always have something to do. There are always all kinds of great conversations and opportunities to do things. That's what I love about nursing. I love everything it has afforded me. I absolutely love my job. I know not a lot of people can say that. Do I go home from this office someday saying, wow, I wonder what they pay at Sheets, because this was a tough one. But you know what? You go home, you relax, you have a couple, I love Mountain Dew. I hate to say that, but have a couple Mountain Dews and you're like, okay, I have enough energy. Let's go back. And the next day is absolutely amazing. I love being on the floor, meeting the interns. Like I said, I love recruiting. I love talking to nursing about, what do you like about it? I really push my senior nurses to step out of their comfort box. I've talked many people to going into clinical manager positions and nurse manager positions, because what I hate to see is a nurse that is just, they're stale. And I call them my every other Thursday nurse, and every other Thursday nurse is just waiting for payday. You don't want that nurse to take care of you. You don't want that nurse to care for your loved ones. Nursing is all about learning and growing and expanding. And that's my focus. As much as I focus on folks in school, I also focus on the folks that are my 15 and 16-year critical care nurses. What do you want to do? How are you expanding? Do you want to go back to school? I appreciate them. I love them. They're my preceptors. They're my everything. But when you start to not see outside of, oh, I'm just a critical care RN, I hate to hear that. And they will tell you I am after them. I am constantly, come on, guys. If you're not happy here, what else can we do? Can we put you in the cath lab? Are you ready to expand somewhere else? I think my biggest message is if I would have just stayed a CNA or an LPN, I'm sure I guess I would have adapted. But I mean, nursing is so diverse, and the growth that you can have in nursing and the different avenues and the different career paths that it can take you, it's just amazing. If you get into leadership, you're going to have lots of crucial conversations. You're expected to have those conversations if you're going to grow nurses, good nurses, if you're going to grow good leaders. You just never want to just, oh, I'm good. If you're good right there, good. Then continue to learn and to, grow the people around you and be that role model. We need great mentors. We need great role models. But again, the journey has been absolutely amazing. I'm still not ready. Maybe in about 2 to 3 years, I'm looking at maybe doing something different. Retirement. I'm hoping to retire. But again, this has been my career. Nursing. I've loved it. I've got to see a lot of folks. I've got to see some of my RNs become NPs, CRNAs. And it's so great to watch as they just continue to take that step and to continue to evolve and to, I just say to go and to grow. So that's pretty much my story. Do you have any questions? Because I'm going to say, okay.
Any questions for Teresa while you have her in your midst?
So, hi, Teresa. My name is Kelly Oakland. I'm actually the Director of Quality and Compliance at the VNA at WellSpan. So this is like a whole WellSpan party here. So my question for you is, with the merger from Summit to WellSpan, how did you guide your team through that change?
Well, we had lots of conversations. Crucial conversations, because I was a Summit Health girl from the day I walked in here. So I felt that I was going to be the best mentor to say, listen, guys, we know there's going to be bumps in the road. We know that going into it, but we want to grow as an institute. We want to grow. We want to be able to compete with the UPMCs and the Geisingers and the Hershey and the Penn State. If we are going to be competitive, we're not going to be competitive as Summit Health. And I feel, yes, there were some certain things that I had to wrap my head around with some of the different WellSpan policies. But I will tell you, it has been absolutely amazing. All the positives and all the different resources that WellSpan brought here, they are so numerous I cannot mention. The tuition reimbursement, the benefits, some of the ways that we do things. It has been amazing. And yes, again, those bumps in the road have evened themselves out. And as we continue this path with WellSpan, it just continues to get more of a smooth ride. So I will answer that question saying, I continuously kept an open communication with senior leaders, with my leaders. I have 21 nurse managers and clinical managers and educators that all answer to me. And I just kept talking to them and meeting them at their huddles with staff and answering questions. The fear of the unknown was the biggest thing. Answering those questions to say, well, what about this? What about my retirement? What about this? I think if you can take that fear of the unknown out of any type of merge and continuously keep that open communication open with not only your leaders, but your staff, I think that helped with making it a better and a more smoother transition.
Thank you.
Wow. Teresa, I have a question. This is Lisa Homa. How important do you think mentors were in your path? I know you had a director who was clearly very lucky to have an employee like you, and that you were a willing participant in every time that she encouraged you. But how important are mentors? What do you think?
It was everything. It was absolutely everything. As an LPN working in a critical care unit, they didn't have CNAs in the critical care unit. It was the model of care was an RN, and the RN had their assignment, and then they oversaw the LPN assignment. So I still took care of the critical patients. I couldn't at that point give IV medications, IV pushes, but those RNs were the greatest mentors. Just watching how they carried themselves, how they handled talking to patients, how they handled talking to the physicians, the family members. I just loved it because I modeled my care after them. And some of my greatest lessons that I learned were from not great mentors and maybe some not great leaders that I saw in my span of career. But you know what I learned from them? How not to do it. How not to say those things to families, and how to say things to patients, that the hard conversations you have to say to patients. So whether you were a good mentor or a not so good mentor, I took notes. I learned from everyone that I could, even leaders, great leaders, not so great leaders. I watched, I mimicked some of it, and others I just kept in a notepad in the back of my head and said, I hope I never say that to somebody a day in my life. But it's lessons. I look at life as a lot of lessons, a lot of opportunities to do the right things, and to just maybe be that difference in somebody's world, be that difference in a new nurse or even a senior nurse, to say, wow, that's, I appreciate their leadership, and I appreciate them saying the hard things, and enjoying having to say, or getting the chance to say, the easy things too.
Wow, that's such an awesome answer. I'm sorry, anyone else have any other questions? Because Teresa, I feel like I already want to spend the whole day with you. So I'm completely sold. I may come back, I may leave academia and come back. My other question is about positive work environments. How important do you think that is from your leadership journey?
If you want folks to come and work for you, you've got to have a positive work environment. You spend so many hours in here that it needs to be enjoyable. You have to like what you do. It's not about the money. Yes, the money's there, it pays the bills, it helps, it's a great career, and it pays well. But I'm going to take the instance of critical care. Critical care sees a lot of death and dying, and has a lot of conversations that are sad with folks. And especially during COVID, it has been horrendous. And I have to provide, my nurse manager and clinical managers, we have to provide the best working environment we can for staff. It needs to be safe. It needs to be nurturing. It needs to be full of growth. It needs to be full of open communication, and it has to be enjoyable when you come in and start your shift. They're 12-hour shifts. They're really 12.5-hour shifts. I think the working environment is everything, because then you have staff that doesn't want to look outside the unit. They're happy. You can decrease turnover. In our critical care unit, we really don't have a lot of turnover. What I have in that unit is turnover for higher learning. They want to be NPs, they want to be CRNAs. And my open positions, I've never had an open position longer than 6 months. And 6 months has been the longest because of COVID.
Oh, wow. Oh my gosh, that's so awesome.
So I think the environment you provide for your staff and your leaders is absolutely everything. It's right up there with having great mentors, because, why look outside? If you're happy in the house that you work, and you're happy with your coworkers, and what I tell the coworkers, I don't expect you to go shopping at Walmart and break bread with each other, but inside these walls, as coworkers, you will be respectful. You will enjoy working with one another. I don't expect you to have a relationship outside. And if you do, you do. But inside here, you're going to like each other, really like each other, and you're going to support one another. Without that support and open communication and guidelines on how to be, good people sometimes, and kind and patient people, you've got to provide the environment, and you've got to provide the safe work environment that people feel like they have a voice and they know that you have their back.
Well, I just want to put a plug out there, Teresa. I did not pay you to say anything that you just said, right?
You did not. I'll say it all day to any group that wants to hear it. What you get on Monday from me, you get all through the week, and even at my house.
Well, everything you just said is, I feel like what we're teaching in our course, and it's been my philosophy in a lot of different leadership roles. So, and academic standards, you have an A+ here tonight, Teresa. And I just want to say that I feel inspired and uplifted after you sharing your story with us. And I'm so grateful. I know you'll have an impact on all of us and our students to come. So thanks so much for coming. And we're just so grateful that you're here with us.
Thank you for inviting me. I love doing this. And Lisa, if you do decide to change careers, I have positions.
I may consider it with all the pay hikes, Teresa. We'll have to talk later. Well, thank you. All right. Well, no other questions before?
I have one more, if you don't mind,
Okay.
Teresa.
Okay, one last one.
One last one. With COVID and your critical care teams, I know that they're like exhausted. How are you encouraging your nurse leaders to build resilience or that self-care? Or I know at the VNA, our staff is exhausted, and that's an area we're really struggling with, is really trying to help them do self-care, have that work-life balance, and just really deal with, this next surge that we were really hoping wouldn't come. So just any tidbits of advice or information that I can steal from you, I will.
We feed them a lot.
Okay.
We work for food.
Yes.
That's true.
We bring in a lot of candy, not community food because we're not allowed that, but we feed them a lot. We try again and keep an open communication to them. We listen to them when they say, boy, this would work better if we bought this or we did this. And, we want to run a budget friendly unit. So we do what we can, but we really do listen. If we know they've had an extremely stressful day or they've lost both their patients, and that has happened in a day's time. They've lost both their patients to COVID. They've been on vents. We give them a break. We'll have a clinical manager say, go in the break room. You're going to stay in there for a while. Do you need EAP? We actually have a clergy on hand, and every Monday he comes and he has a prayer for our CCU nurses. They ask for that. If they could start the week out with prayer. Those that do not want to participate. It's come as you want to. While we finish huddle, because we have a 15-minute huddle at the beginning of our day. We have a 15-minute huddle at the end of our day, the beginning of our night shift. We talk about, hey, how we got through the day. Any little thing that we could do that we think impacts. We have boards that support each other. We have our care team that does special things for the staff, and then we put up an appreciation board. Family meetings, but our families have been so good to us, and they've been so good to our nursing staff. They're like family, whether, it was a successful COVID case and we got to see that patient go home, or it was not successful and the patient passed. We try and do nice things for the family because it makes us feel good. We do like thumbprints for folks that have passed away from COVID or just passed away in general. We try and do the nice little things for our families because that makes us feel good and it makes our staff feel good. So any little thing that we can come up with, or staff says, hey, can we do this? I know we're not allowed to do a whole lot of stuff with food, or, we'll try and get therapy dogs in the door or therapy cats if we can do that. So anything that will help lighten the day, or we think that will help take the load off the staff, we're up for it.
Thank you.
That's awesome. Thanks again, Teresa. Well, I think you're off the hook, Teresa. So now it's time for us to torment another person from WellSpan. We're grateful to have her. So Dina, if you wouldn't mind, if you're ready to, however you want to start, the floor is yours.
Okay, great. Well, thanks. Thank you so much for having me. And I have to say, Teresa, I was sitting here watching and listening to you, and it just equally, I love my job. Like, I love my job so much because I love nursing. And listening to you talk just made me think every day how much I love coming to work, even though I work remotely now. I love coming to work every day. And just to give you a little bit about me, I actually came to WellSpan back in 2002 as a nursing student. So fast forward, I had 2 children who were diagnosed with bleeding disorder. It is genetic, so we were aware, but when they were born, we knew that times could be a little challenging, and with a spouse that traveled and me being in school, it was a lot. So I had decided to take a step back and stop my nursing school so I could be home for my sons, and realizing that I can't be in a job and do my very best if I have to run home to take care of them because they're having a bleed. So I decided to put my nursing career on hold, and I continued working in the PACU at York Hospital, where I learned a ton from so many nurses who were very happy to mentor me and help me along. And at that point, after 8 years, it was decided by me that I would forego my nursing career and look for something equally as rewarding. So I pursued a position in HR, and I was hired as a clinical employment assistant. So I was able to support the nurse recruiters who were hiring nurses, so I could still be in that clinical world, but be able to go home and take care of my kids who required twice a week infusions, first up at Hershey, and then we do them at home for the rest of their life. So nursing just wasn't in the cards at that particular time. And a year after I moved into HR, which was in 2010, I was promoted into a recruiter position. And for 3 years, I worked with rehab medicine, so PT, OT, speech. And then the following year, I started supporting nursing support. And then I went into nurse recruitment. And it is by far the most rewarding job I have, because I get to talk to all of you every single day and hear about why you chose the nursing career that you have. And for those of you who are changing careers or just starting out, it's great to hear your stories, because I am living vicariously through all of you to get my fix still. And the best part of my job, outside of working with the students and registered nurses and LPNs who are graduating to be registered nurses, is that I get to be a nurse to my children, because they don't have to go to Hershey anymore. I get to stay home with them and do all of their medical stuff at home. So I am exactly where I'm supposed to be. And I am absolutely overjoyed, really, every day, because I get to work with all of you. So hearing Teresa's story, I'm just like, this is great. This is why I do what I do, because she works with all of her staff to make them these phenomenal nurses, and I help get them in the door. So I feel like my knowledge and my passion for nursing really benefits you if you're talking to me about opportunities, because I am deeply devoted and I want to help people find places with us. And sometimes that doesn't happen. It's not meant to be with WellSpan, but the door is always open, and I try to create those relationships so the applicants, candidates, and the managers that I work with feel comfortable basically calling me at any point at any time in their career for, resource guidance, career help, that sort of thing. So that's a little bit about me and why I do what I do. As far as, and I'm just going to open it up to questions, because usually once one person asks, we kind of go down a path. So that's a little bit about me. I do support nursing at WellSpan. I primarily hire for the emergency department, some med-surg areas. I have all of the externs at York, our rehab hospital, and Gettysburg Hospital. So I love working with that group as well. And I think, and the rehab nurses at the WSRH. So I'm happy to turn it over to questions, because I love to answer questions too.
Questions? I just have to say that between the two of you, I feel choked up and so inspired by what you said. I thought I was going to start crying, Dina, when you started sharing your story.
Yep.
Oh man, I wasn't prepared for the two of you tonight at all. Wow.
Yeah.
I have a question, a recruitment question, and it's about culture. So I have these struggles. So square peg, round hole. Who fits who as far as finding your cultural fit of an organization? Can you share any insights into that or your thoughts?
Yeah. So when I first start talking with folks, I really want to know about them and what they want. I mean, I can sit and tell you all the positions I have open, but that's not really going to benefit somebody if I don't understand what they want. So I always ask a lot of questions. I take a lot of notes because I can send you to any manager, any department, any position, but if you don't like a wild, dynamic, crazy, chaotic floor, I'm not going to send you to 4 Southwest. If you're looking for more of that, small knit, tight knit group, I'm probably going to put you towards 5 Main, depending on what your interest is, as far as like med surg, critical care, that sort of thing. So really understanding what you are looking for in a career or in a unit or a group really helps me direct somebody to an area. And I think that's why it's really important that I understand what all of our units, how they are, how they're built, how they work. And I don't know everything, but I feel like I have a good wealth of knowledge simply because I've been part of WellSpan for such a long time. And sometimes it doesn't work. It doesn't fit in with your life, the candidate at that particular time. And that's okay. And what I find with folks when they're realizing that it's not going to be a match, they feel bad, they feel guilty, which is normal. But in reality, you have to do what's best for you. And if it's not with us or that unit at that particular time, it's okay. Maybe later on down the road, when something in your life changes, you'll come back and say, hey, do you think we could talk again? And I've done that multiple times, which is why like relationship building is so, for me, it's super, super important, because I'm still talking with folks that I hired back in 2011. So for me, that tells me that I'm doing exactly the right thing, and the people put trust in me to be able to help them with that.
That's awesome. Anyone have?
So what do you recommend for your newer nurse leaders as far as like interviewing and how, so you kind of did the pre-screen, you try and figure out, by sending them to the right floor. How do you instruct new managers in the interview process to really determine if it's a fit for their unit?
So you mean for the new nurse manager interviewing a candidate?
Yeah.
Okay, all right. So there are leadership courses on the HR side of things. I don't believe they're required, but there are some programs that we offer newer managers to go through. What I find though, and I haven't had many new managers lately, but when I get a position for that manager, I'll reach out to them and just kind of go over what my normal process is. And sometimes, depending on where they've come from, they'll say, well, this is what I did at my other hospital. Well, what do you think about this? And I really try to make it a very collaborative environment, because I'm not going to tell you what to do. I'll certainly recommend things, and I'll say this has worked really well in the past. Interviews, obviously making sure you don't ask anything illegal. That's probably the biggest piece that we would want to make sure that you know what to ask and what not to ask. We don't want you asking anything illegal, because obviously that wouldn't be good for anybody. But really, for me, it's really that collaborative relationship. I talk about it all the time, and just making sure it's a partnership. We work together. There's all these different nuances when it comes to recruiting, which most people don't think about because you don't do it every day. So like posting a job, you don't really think, how should I post this job, or what details should I include? Because that's really our area. So sometimes, in fact, we just had a recommendation from a new senior leader at York Hospital. And I mean, it's a great idea. However, with the way that our systems work, it probably wouldn't be the best thing, but because nobody has talked to her about that. She doesn't know any differently. So it's really about the education piece, building a collaborative, relationship with this newer leader, and really keeping, like Teresa said, like she said so many things that I was like, yes, yeah, this is exactly right. Keeping those lines of communication open, because honestly, every success and every failure has come from some kind of fantastic communication or really, really bad or non-existent communication. So for me, communication is at the crux of everything I do. I mean, obviously, my mom said you love your job because ever since second grade, you've been able, you talk too much and now you get to talk for a living. So this is really great. So communication is definitely key.
So I'm going to keep asking on this lane, and I'm taking complete advantage of you because you work for WellSpan and getting work-related questions answered. So I also have, I have a manager that I'm thinking of where myself and our field staff educators at the VNA keep going like, why did you hire? Like we've had quite a bit of turnover in the first few weeks of orientation or within a couple of months of orientation, and we don't see it. I mean, you always have that because you get somebody that's in home health, had no clue what they were getting into, and like, whoa, this isn't for me. But this seems to be like a trend with, you have a heartbeat, you have a nursing license, we're going to hire you, or not asking. So would you recommend those same type of classes, like, I don't know if they're LMS classes, for even maybe not some not so new leaders who?
Yeah. So we get that a lot. It's like sometimes we hire people, and I'd like to think that we as an organization just don't hire people with a heartbeat. I know sometimes you only have 3 people to choose from and you end up picking one of them. Maybe they weren't the top choice, but again, I think there's so many pieces to the finding the right person puzzle. So everything is just a part of that puzzle to help you make that decision. And based on everything that we know from a resume, cover letter, phone interview, in-person interview, shadow, field experience, whatever you want to call it, that whole process, it's still only a piece of the puzzle. And even when we put it all together, we think it looks right. We think the picture is right, but then the person starts and it's like, wait, what the heck, what's going on? And was it anything that we could have seen during any of these parts or any of the pieces of the puzzle? And sometimes you may have a pattern of doing that. And what I always say to managers is, okay, let's go back. Let's talk about the questions that you're asking. A lot of the questions that we recommend are behavioral based, which is, like the new thing, ask behavioral based questions. You ask yes or no, that's not, sometimes you can ask those, but generally behavioral based questions is what we recommend in terms of, getting a bigger picture. But just like anything, you could sit across from somebody and have an interview and they'll answer everything exactly as you think they're supposed to answer, even situation-based questions like, you give them a case scenario of what would they do with this patient. Well, they're sitting across from you. They're not in the unit trying to figure it out when, 5 other things are going on. So they're probably going to answer it correctly. I think shadows are a huge, huge factor in interviewing. And I know during COVID, we couldn't do that for a while. And that was really, really tough because managers were making decisions based on this, the Zoom interview. Woo-hoo! Like you can't even see the whole person. So shadows by far, I think, are the best indicator of what you're going to get when that person is working for you, because they are in a situation where it's new, it's uncomfortable, maybe it's different, and they're working alongside a staff person in the middle of their day. And, I've always encouraged applicants when they do the shadows to make sure that they are engaged, they ask questions, and usually after a shadow, it's gone really well or not so well. So I don't know if you do shadows with VNA applicants, but I think you do, because I work with my colleague who handles VNA. But if you don't do them, I would strongly recommend doing them.
Thank you.
You're welcome.
That was my question, Dina. I was gonna, as the researcher, you have to just bear with me. I have all these questions about data and things that you look at, but you answered my question because I was going to ask you about shadows.
Yep.
My other question along the same line is about psychometric testing. do you guys use psychometric? So I'm not a WellSpan person, and I've never worked at WellSpan, but do you believe in it? Do you think it's predictive? It helps?
Okay, so once again, so we use, we call it an assessment or a survey, and it's
Okay.
120 questions that for every person that applies, the
Wow.
the link is available for them to take. And we encourage all the nurse managers to use the survey during the interview process. So yes, we do have it. We don't track it because there really isn't a great way to do that. It's really a guide for the manager when they're doing the interview. So we do have it. Is it predictive? I think it can be. I mean, it's a test, or it's not a test, but it's a questionnaire where you're like ranking different things and you have preferences and so on and so forth. Again, it's just a piece of the puzzle. So I'll tell you a quick story. This is back in my rehab days when I had PT, OT, and speech. And we had a candidate who took the survey, and the managers used it during the interview, and her rating on energy was very low. So that's one of the, I think it's 9 categories. It was very, very low on energy. And so the question was posed that, you know, you're on your feet most of the day, going back and forth to, you know, do patient visits and that sort of thing. Obviously, some days are more overwhelming than others. Well, how do you handle, you know, how do you handle that? And the response was something along the lines, and mind you, this is back in 2012. So, but it's a good example. The response was something along the lines, well, I would take frequent breaks and I would sit down, and okay, fine. You can sit for a couple minutes. Well, she wasn't selected, not because of that, but her interview and her shadow wasn't great. But she came back and said that we did not choose her because she looked a certain way. And luckily, the assessment or the survey and the questions that were asked, we documented all of that, and we were able to use that to support our decision for not hiring her. Otherwise, we probably would have had a little bit of a legal issue if we wouldn't have had it documented. But yes, we do use it. We encourage the managers to use it. Is it used all the time? Probably not, but it is something that we do strongly recommend that the managers use as a piece of the puzzle in making that informed decision whether to hire somebody or not.
Wow. That's awesome. Thank you.
You're welcome.
Yes. Oh, we have another question.
For interviewing millennials.
Oh, here comes the millennial question, Dina. Oh, woo, I knew it was coming. I should have known.
Yep.
Like there's millennials, there's
Gen Z, yeah.
Yeah.
So, you know, I think that my impression is that a lot of them tend to go from position to position, or only stay in one area for a certain amount of time before they're moving on and moving on and moving on. So when you're interviewing someone who has frequently moved, you know, 1 year here, 6 months there, 18 months in another place, like how do you handle that? What do you look for? Because they may be valid reasons for leaving, or
Yeah, I think you hit the nail on the head. So one of the things is, you know, we look for on a few of our postings, we put solid and stable work history. And the days of folks staying in positions for like 10 years plus, I mean, you have those people, but those are very far and few between. And so what we see now is a lot of what you just described. So if there are valid reasons, everybody's valid is different. But if it makes sense, spouse moves jobs, I mean, they can't necessarily control that. But if there are valid reasons, or you see growth in what they're doing, I mean, certainly that makes complete sense. The ones that I see red flags for, and a lot of our managers see red flags, is when they hop from hospital to hospital after a year, and the reasons that they give for why they've changed. And they are pretty upfront. Most of the time they'll say, well, you know, it was a challenging manager, or the environment wasn't what I was hoping for as a new grad, or things along those lines. Sometimes it makes sense when they give examples to support the environment wasn't for me. And we find something that it meets more of what they're looking for. Because again, I mean, just as we're interviewing them, they're interviewing us. So you know, to talk to a manager for 30 minutes or an hour, and then going to shadow on a unit for 2 hours. Well, you may have had a really great day that you saw, and then you come in on your first day after orientation and it's like complete chaos and it's not what you thought you signed up for. So I think with all of that, again, it's asking the questions, digging deeper to find out the reasons why they moved around. If I look at a resume and everything looks solid and I feel like, okay, you know, I'm just going to send this person through, I don't necessarily screen every single applicant. If I see something that raises a red flag or a yellow flag that I'm a little concerned about, I will reach out. I call them. We have a conversation. They kind of give me, you know, what's going on. And I will tell them if I believe it may be a red flag, I will send them through. But if it's a concern from the manager's standpoint, then I do make them aware of that. And I will say the response that I get from having those conversations, again, Teresa, those crucial conversations that are not real fun to have, but you have to have them. They do. I mean, I feel like they do appreciate because I took the time to talk with them. It's when you don't, and they just get no thank you letters after no thank you letters. They're like, what am I doing wrong? So I think the more you spend with them and being proactive up front takes care of a lot of that reactive stuff that may happen in the future. But you're right. We have a lot of folks. In fact, our externs from York Hospital this past summer, they wanted what they wanted. And if they couldn't have it, they were going to go find something else. And it wasn't, it was like the overarching attitude that came from them. And it wasn't necessarily bad, but it's what they know. It's what they know. And if you talk loud enough and if you say it long enough, somebody's going to give you what you want. We didn't do that, but we did try to work with them because a lot of the scheduling issues, which was the problem this summer, had to do with school. And obviously we want them to finish nursing school. So we were able to work with them, but we had 2 people that said, I can't work nights because mentally it's not safe for me to do so. And I thought, and I talked to our coordinator and I said, help me with this because they're in nursing school. They are going to work in a 24-hour setting when they are done. How do we handle this? So, you know, she did some talking to a couple of them and we did find something that suited them. And we just got a little more detail and we were able to make it work. But it is definitely, it is challenging sometimes to work with, I'll say just certain groups of people simply because of them being a millennial or pick another generation.
Wow. Anyone else have other questions for Dina? Dina, it's so amazing hearing your insights because I feel like it's like nursing against recruitment in a lot of ways, because it's sort of like, how do we outsmart, or like, it's like a game almost. It's a strategy when you're going through that process, looking for a new home. So it's amazing to hear your insights and everything you shared with us. It's very helpful.
Sure.
Well, I think that concludes our questions. I think they're all set. Again, I can't thank the 2 of you enough. Oh, okay. And then Patty also has her email and all that stuff. I'll definitely share that with the group and post it where I put our recording and all that stuff tonight. But we're so grateful to have you. You've just made our whole night. And I'm not going to cry getting off the call, but I have to say I do feel moved. So, so thank you for sharing and everything. We are so grateful for your knowledge and expertise tonight.
Thank you again for having me. This was it was enjoyable. And Teresa, I could talk to you for days.
Come on over. All of you just come on. We'll just go shopping. We'll do something. Thank you guys. Thank you.
Thank you.
Teresa, I'm going to find you at the next leadership forum when we finally have them in person again.
Oh.
Oh, thanks again. Really
Thank
appreciate
you.
it. Have a good night. Hey, El, you don't have, I'm going to check with the group. So I had a PowerPoint just as a backup plan, but we don't have to. We had awesome speakers. I'd be curious to hear how you feel about it. And I can send you home packing, or I could just go through my little leadership spiel. So you can let me know if you're had enough and you're ready to say uncle.
Can I just share the awesome
Yes.
experience that I had today with
Yes.
the crucial conversation?
Yes.
So I'm so excited. I, as I'm not sure what papers I put it in, so I know Lisa knows that, but I'm mentoring a new manager in our hospice. We have a very small hospice, very tight-knit team. We had a new on-call nurse come on who came from a bigger hospice agency, is definitely more focused on evidence-based practice than our little hospice kind of does a lot of cookie cutter stuff, which we're trying to break away from, but they took her like giving suggestions and stuff like they didn't know what they were doing. So it's turned into this really bad toxic work environment when she's on call and everything. So we've been working with her. I've been working with this new younger nursing supervisor to, you know. So we had this one on-call nurse and one full-time hospice nurse have like just been making subtle digs at each other, and it's just really been not a good situation. So we finally brought them in together today to sit down, review the WellSpan values, and have a conversation about what like, and actually got it from HR, so very grateful for HR. It was actually a paper that had the WellSpan values, and then a question of what are 2 things that I can do to make my working relationship better with this person, and then what is one thing I would like the other person. So I have to come up with 2 things myself, and then ask the other person for one thing. It was amazing. It was absolutely amazing. The nurse who kind of comes across demeaning felt excluded, so she was just trying to explain that she has hospice experience. Well, the other nurse was taking it as coming like, and it just opened up like, you know, all these things, and it was just not like, it was a start, you know. Do I think it's going to be unicorns and rainbows overnight? Absolutely not. But it was just like, it was so good, and they both felt better. Our new manager was a part of it, and she was asking questions to help clarify and kind of reframe when she felt somebody was saying. So it was just like, it was, awesome. And she's been the newer manager has been not sleeping well, and this has really just been keeping her up at night, and you know, and everything. And so I said to her today after the meeting, I'm like, so you're going to be able to sleep tonight? She's like, I feel so good about this. Like, I feel hope again. So I'm just so excited that, and I used the one article on incivility. I can't say the word today. So I said it, I think in one of the papers, like, I'm so grateful that these courses are having a direct impact on what I'm doing at work. So thank you both for that.
Oh, that's awesome.
So,
That's
yeah.
awesome. Dr. Francis, anything you want to say?
No, I think your speakers hit it very well on the head. You know, the leadership component is something that is extremely valuable as we move forward in things, and what they talked about how to be a good leader was exactly some of my very own experiences. You and I, Lisa, have had experiences with good leaders and with not so good leaders, and we learn from both.
That's so true.
Yeah.
So true. That is so true. I have to just interject. Dr. Francis, is that your new fancy house?
That's, yes, it's, you know, it's a room that doesn't have boxes in it right now. But I will tell you, as I think I told you before I left, I did bring way too much stuff.
Oh, well, I miss you terribly, Ellie, miss you terribly. So if you didn't already know, Dr. Francis moved to North Carolina. So she'll be Zooming with us probably permanently until I drag her in for our site inspection, whether she wants to come or not. When the accreditors come, she has to. She's built the program with us. She's part of it all. Wow. Well, miss seeing you terribly. So I'm so glad. It looks beautiful.
Yeah, it's coming together really nicely. There's still a lot to be done, but you know, I know the builder, so it'll get done eventually.
Yes, you do. That's right. Oh, that's awesome. So are you guys, do you feel good? Do you want to call it an evening? How do you feel? If not, I will be happy to put you to sleep with a PowerPoint for a few minutes. Really, but I have to say, Teresa really framed most of the things that I will talk about. And the only thing that I really was bringing up tonight is just applying comfort theory to what we can do as leaders and with our staff. And I really think she said everything in my PowerPoint, honestly, because she talked about transparency, safe environments, creating trust, all those components that are really important to us. And she just showed that it works. So maybe this is a good place for us to just call it. Anything you'd like to say, Dr. Cardenas?
No, I thought it was a great experience listening to both of us from both sides. you
Yeah.
know, The HR side, because you do think when you're applying for a position, you're like, why is this recruiter calling me? What do they know about
Right.
this job?
I
You know?
agree.
Right.
I've had many people say that to me when they come through or whatever. And it's nice to see why they do things, how they look at things. And yeah, I really listen to both of them.
Yeah, me too. I've had experiences where I've had speakers come in where it was not a good experience. And so I didn't know how it was going to be. And then I heard, oh man, so we have a recruiter coming in. So I didn't know what that was going to be like, but they were awesome. They complimented each other so well, and they were just awesome. So now I'm going to have to bribe them somehow to get them back for the next time our leadership course runs. Whew, it's going to be tough to get them. They're busy people. So
And it's really nice to see the energy that they both have.
yeah.
Sometimes people don't have that energy, and I know with everything with COVID, and it's resilience is a big issue. But just the energy, I mean,
Yeah.
And Teresa's very inspiring.
Yeah, I feel so much better after hearing them because I had a drag down day, but I felt much better after hearing them. So, so it was good. Yeah, it was good. All right. Well, I think this is a good time to break then. Well, Dr. Francis, off to you.
Okay,
Talk to you soon. Great to see you.
good evening. I will talk to you soon.
Okay, take care.